This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Gabaneuron Sr 600 mg tablet is a potent combination designed to manage nerve pain effectively. It combines gabapentin and methylcobalamin for optimal results. Indications and uses. This medication is primarily used to manage nerve pain, particularly neuropathic pain caused by various conditions. It is also beneficial in promoting nerve cell repair and rejuvenation, making it a suitable choice for individuals suffering from diabetic neuropathy and other nerve-related issues. How it works. Gabaneuron Sr 600 mg tablet works by reducing pain sensations through gabapentin, which interferes with pain signals, while methylcobalamin helps repair and protect nerve cells. Directions for use. Take Gabaneuron Sr 600 mg tablet as prescribed by your physician. Swallow the tablet whole with a glass of water, do not crush or chew it. It can be taken with or without food, and it is important to adhere to the dosage and duration recommended by your healthcare provider. Do not abruptly stop taking this medication without consulting your doctor. Possible side effects. Patients may experience common side effects such as dizziness, drowsiness, nausea, and increased appetite. If any troubling symptoms occur, it is advised to consult a healthcare professional. Precautions and warnings. Prior to using this medication, it is crucial to inform your doctor about any existing health issues or diseases. Caution is advised for individuals with conditions like kidney or liver disease, as well as pregnant or breastfeeding women. Monitoring is essential to prevent potential side effects. FAQs. 1. How long will it take for the medication to start working? It may take 2 to 4 weeks for noticeable relief. 2. Can it be used to manage diabetic neuropathy? Yes, it can provide symptomatic relief for diabetic neuropathy. 3. Is it safe to stop taking it suddenly? No, consult your doctor before discontinuing use to avoid withdrawal symptoms. Thank you for watching this video. If you have any questions or suggestions, please leave a comment below. We appreciate your engagement and look forward to your feedback.